Health officials say the first person to die from complications of COVID-19 died 1 year ago today. While the pandemic continues to rage across the U.S., we're actually feeling relief from other respiratory illnesses. Gabriela Becerra explains why doctors think this flu season is unlike any other. Gabby?
Well, Amanda, the number of flu cases is so low, it's almost shocking. And although no two flu seasons are identical, doctors say there's an obvious reason why this one is very mild.
This one hardly feels like a flu season at all.
Unusually low. That's how the CDC and local doctors like Nasia Safdar are describing this flu season.
Typically, it starts around November, December, give or take a few weeks, and then continues well into February and March.
So far this season, UW Health has treated 1 patient for influenza. By this time last year, that number was 971. The CDC's map shows both the state and country have minimal flu activity.
Some seasons are better than others, but one where here we have hardly any cases is I can't remember that happening in recent memory.
Really, historically, nearly unprecedented.
Both Safdar and Richard Keller, a UW-Madison professor of medical history, say there could be many contributors to this mild season, the most obvious being COVID-19 precautions.
Masking, hand hygiene, not engaging in large gatherings, all those things are helping curtail the transmission of influenza.
It's too hard to say if people will choose to throw a mask on during future respiratory infection seasons.
People do tend to think of flu as a fairly mild nuisance illness rather than the killer that it can certainly be.
But if there's one thing Safdar hopes people take away from the pandemic, it's recognizing that when you're sick, you should stay home.
You shouldn't be around other people. You shouldn't go to school. You shouldn't go to work. And, that was always a recommendation, but it was variably enforced, and many people didn't necessarily follow it. And now it's being followed, and that, I think, should stay.
Keller says the only real downside of having a mild season like this one is it makes it much harder to predict which strain will be popular next year, and that affects our vaccine planning. Amanda?
Gabriela Becerra reporting live tonight. Thank you, Gabby.